The 2008 DC Health Summit is the first step we are taking in setting up a national coalition that will include some of the largest health insurance companies, cutting-edge physicians, hospital administrators, pharmaceutical firms, and politicians.
This is the one group that's come together that has put aside their special interests.
We're only going to be able to collectively make a big difference if we work together.
I think the summit is the start of a long process. I don't think there's any easy answers.
We'll be able to come away with some ideas on how to improve the general health of the American public.
What we really need to do is sit down and really negotiate and talk about all the issues.
It's this kind of dialogue and collaboration where we can take steps to moderating the dramatically increasing costs of healthcare.
Diving in, engaging the hard issues, and having a frank discussion about it.
And everyone was in the room because they wanted to work on promoting health and wellness.
The end result, which we all agree with, improving the health of people.
And it's really a great pleasure to see such a wide range of perspectives brought together in one room to think about this really complex issue.
The charge that we've been given here today, and that is we've got to change this system.
We have 47 million people who are uninsured, including at least 8 million children. We have high and rising costs, and they are coupled with tremendous inefficiency in our healthcare system.
Majority of chronic diseases that we're treating in this country, most of it appears to be lifestyle related. Unhealthy behaviors in the United States leading directly to health risks, those health risks leading directly to chronic disease, and you know what's next. This is where all the cost is. That's how much of the healthcare cost increase we can really dramatically impact with wellness. It's this part right here that worries me.
Through wellness programs and those types of things, we can make a dent in that cost. But what you saw was that large gap that he said his wellness programs, even if they were fully implemented, weren't going to deal with. Unless we tackle utilization of services and the underlying expenditures, we will not substantively address the cost problem.
You mentioned the issue of, would people take advantage of it? I understand we have one of our participants today, Priscilla O'Donnell.
So we entered this wellness initiative in April with a $10,000 budget, $5,000 from our healthcare provider, which we were very thankful for. And in April, we gave out pedometers to everybody. We started a 10,000 step program. In May, we added on-site Weight Watchers, and we have actually lost more than 700 pounds since May. And that is amongst 25 employees.
The reason that we don't have more employers like Priscilla doing this is a variety of reasons. Some just don't get it, they don't understand the value and the benefit. Also, as the doctor mentioned earlier, most employees really don't have a strong motivation or desire to change their lifestyle. So if the employee isn't interested, why should the employer be interested?
Look at healthcare literacy as an issue. It's incredible. 25% of our patients have no idea what we say to them when we say, do this. Anybody who's had a medical illness, they smile, they listen, they have no idea what the hell you're talking about. And it's scary. That's 25%. If we can reduce the lack of compliance and the recidivism, folks not complying with their medication, going back into hospitals, Melinda, huge savings on healthcare costs.
And if you ask me specifically what types of programs, wellness programs, disease management programs, things like that, Senator Obama would support, I think if he were here today, he would probably say all of them. Because if something has promise, we should try it.
Will wellness help? If we just pick cardiovascular disease as one example, that by changing culture and by changing lifestyle and changing risks that are changeable, we can definitely decrease healthcare trends.
We also have an incredible dearth of primary care in this country, and we know that primary care, taking care of the same condition, tends to cost significantly less and provide higher quality than seeing a specialist for the same condition. But right now, only 2% of medical graduates are going into primary care. So what are we going to do in a few years when we're sick and we want to go see a doctor? You have to choose your organ and go see the doctor, the specialist of the organ of choice.
Malpractice insurance costs, for example, that cost alone is forcing good doctors out of business. I will tell you that OBGYN doctors and neurosurgeons and cardiac surgeons that have never had a lawsuit in their practice are paying between $100,000 and $200,000 a year. It is unaffordable for liability insurance. It is more money than my father made in a lifetime to pay in a year. There has to be tort reform. Otherwise, it's going to force good doctors and healthcare providers out of business, and you will not get the healthcare that we're used to getting at this time. Americans will not stand for it.
Our plan is to put together a consortium of leaders who will come together quarterly to investigate effective ways all of the parties can work together to lower the cost of health insurance for all Americans. We'll be posting our findings in a report which will submit to the next President of the United States as a suggestion for how to lower health insurance costs. We'd like you to be a part of our team. In the coming months, we'll send out information about our progress and invite you to participate in an online dialogue via the blog we are setting up on our website, www.dchealthsummit.com. Here's to having you part of a national movement to lessen the ballooning costs of healthcare. If we work together and increase and encourage workplace wellness and manage costs, I am confident that we will find a way to make Americans and the system stronger and healthier. We'll look forward to working with you on this important initiative. We all must have hope. Have a great day, and thank you so much. I really appreciate it.